My presentation is on managing treatment-resistant depression, TRD, using ketamine. My name is Chikwalo Ume. Ketamine is an anesthetic and it has no indication for depression at present. It is in clinical trial, and if approved for depression, it will be a major breakthrough in the world of psychiatry. Depression is most common mood disorder. Looking on your left, you will understand how depressed person feels even when they claim they are fine. Depression causes loss of interest, decreased energy, feeling of guilt, oftentimes leading to suicidal ideations, insomnia, and poor concentration. Prevalence of major depression. 6.7% of all US adults are estimated to have at least one episode of major depression. That's quite significant. Depression is higher among adult females than males. From the diagram, you can see that depression is more prevalent in Southeast Asia, 27%. Effect of major depression. Depression costs between $29 to $48 billion annually. That's a lot of money. It causes low productivity due to increase in call-outs from work and increase in ER visits. Depression causes poor quality of life. The diagnostic criteria. Greater than or equal to 5 symptoms must be present during the same 2 weeks, and it must represent a change in baseline. The symptoms must not be related to any other known medical history. One of the symptoms must either be depressed mood or loss of interest in pleasure. Either of the two must be present, plus minimum of 4 other symptoms to meet the diagnostic criteria for major depression. Treatment options. Psychotherapy. Studies have shown that this is poorly utilized, despite its proving to be very effective. Pharmacotherapy. This is use of medication. It's very essential, but care must be taken to understand the adverse drug reaction, the adverse effect of the medication, and drug-to-drug interaction and drug-to-food interaction. This is very important. SSRIs are the first line of treatment. Atypical antipsychotics, preferably second generation like Zyprexa, are also alternatives. Stimulants are better used when a quick response are needed. Then we talk about ketamine. It is an anesthetic, but at subanesthetic dose, it has shown a rapid antidepressant effect. But remember, it's still on clinical trial. It has not met the indication for antidepressant. Then psychotherapy. We have a cognitive behavioral therapy. This helps patients change their negative style of thinking or behaviors, and also focus on changing their thought pattern or their behavioral patterns. And cognitive behavioral therapy limits distorted thinking by realistically looking at the worries. Interpersonal therapy. This focus on patient disturbed personal relationship that worsens their depression. The psychodynamic therapy resolves internal psychological conflicts, probably from childhood. This is most effective if there is established lifelong history of inadequate coping mechanism. Of the three listed, three of them meet the indication for treating depression. And with the best outcome is when you use psychotherapy with a pharmacotherapy. That's when you yield a better outcome, especially when you have a major depression. Evidence of ketamine on treatment-resistant depression. Several studies have shown that ketamine has a rapid antidepressant effects. And also, ketamine is safe and well tolerated. In some studies, antidepressant effect of ketamine had been maintained over 15 days. And also, studies have shown a modest effect of oral ketamine because of poor bioavailability due to first-pass liver metabolism. It has shown to be Ketamine has shown to have a poor bioavailability when taken orally. And also, there is no significant difference when ketamine is combined with other antidepressants. So this study shows that the antidepressive effect is as a result of the ketamine, not as a result of other antidepressants. And also, more studies are needed on response durability of ketamine before practice change. Because since the antidepressant effect lasts about a week, we really have to have more clinical studies for improvement so that we can have the antidepressant effect beyond a week before we can adopt this into a practice change. Benefit of ketamine. Current antidepressants have delayed onset of actions. On average, it's about 4 weeks. But ketamine offers potential for faster onset of action, ranging from seconds to minutes. And also, ketamine has shown improved suicidal ideation on a suicidal ideation scale. That's a significant improvement after ketamine infusion, 40 minutes after infusion. It is safe, it saves costs, and improves quality of life. Disadvantages of ketamine. Oral ketamine undergoes extensive first-pass liver metabolism, resulting in poor bioavailability. And also, reversible cognitive impairment has been recorded in some studies. Remember, as I said, ketamine has an indication for anesthesia, not depression, and is still on clinical trial. So more clinical trials are needed, especially to determine route of administration, long-term effect of cognition, because as we said, there's a reversible cognitive impairment on studies that are done within weeks to months. Going beyond a year, who knows if the cognitive impairment will be permanent. So that's a concern. We need more studies to confirm this before a practice change. And also the sustained effect of antidepressive depressive effect. Because from the studies as we discussed, most of the studies recorded antidepressive effect of ketamine no more than 7 days post infusion. So before implementation for a practice change, we strongly need to have a sustained effect beyond 7 days, to make the treatment worth it and make it affordable, and also to prevent frequent relapse. As I said, these studies are all in clinical trials. Ketamine is not yet an indication for depression, but with the improvement in the studies, it's quite promising that this will be a landmark study that will bring a breakthrough in the world of psychiatry. And as providers, we have more resources to help our patients, especially the population that is suffering from depression. Thank you very much.